To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, welcome to Your Health. Well, today we're going to make the confusing world of Medicare a lot clearer because I'm joined by Aaron Wallender from Northern Advantage Insurance. Thanks for being here, Aaron.
Thank you for having me back.
All right, number one, why should people just not auto-renew their Medicare policy?
It's really important to review every year, especially in a year like this. We are seeing some medical systems have contracting issues with the insurance companies. We're seeing a lot of changes in terms of the medical costs, prescription drug costs, and there's all kinds of factors that change each year. So really, auto-renewing can be fine, but it's usually not a great idea just to let it go without checking.
Probably when we're thinking about healthcare, blindly auto-renewing is not a good idea, right?
Yeah. Especially right now.
What about, you're working with clients, are there any details that people you find tend to miss that really cost them in their healthcare?
Yeah, I think the biggest thing comes into play with like prescription drugs. That's the biggest variable I see in terms of cost, because sometimes a specific medication may be covered by one company but not by another, or the cost that a company charges for that drug may be very different from one company to the next and one prescription to the next. Also, finding things like dental care can be challenging, and finding the services that you need covered to be challenging. So those are like the little hidden things that you might not think about when you're looking into plan options.
When you're thinking about options, everybody's got a guy, everybody knows somebody, their brother, their cousin. Kind of dangerous when you're not going to professional, right?
It's amazing how many experts there are out there. And I run into this all the time where people are like, oh, my neighbor's on this plan, so I'm going to go with that. And I'm like, that's not necessarily the best choice. Let's actually take a look and do a deep dive into your situation to make sure, because Jim down the street might have a good plan for him, but it may not be the right one for you.
And that is really the difference between a licensed professional and just somebody who thinks they know a lot.
Correct. And I mean, whether it's a person that like a family member or a friend, or you just heard about it on the news or whatever, I highly encourage working with a licensed agent, because we are certified. We are every year we have to renew our license every other year, and really have to have a lot of skin in the game to make sure we're giving people good advice.
And our last quick thing, the best part of it, free of charge.
Free of charge. Never a cost to work with me, and no obligation to enroll if we do meet. So there's no reason not to use a resource like ours.
That's so true. All right, Aaron from Northern Advantage Insurance, thanks so much for being here.
Thank you.
And we want to thank you for watching To Your Health.
The preceding was a paid advertisement.